Hello everyone, I'm Priya, a PGV3 internal medicine resident at Ascension Century, and I would like to thank you all for this wonderful opportunity. To start with my case, I'd like to say tick bites are not fun. We had a patient in her 50s who got transferred from the outside hospital for a febrile neutropenia and shock. Tick-borne infections are challenging as they can mimic the other common causes of shock, and we don't really think about them as our top differentials all the time. Our patient had a hobby of mushroom hunting and hiking, which made her prone for tick bite exposures always, and she started having symptoms after about 2 3 weeks of a recent tick bite from her hiking. She hikes in Tipton County, usually of Indiana, and that's one area where ehrlichiosis is never reported so far as per the CDC. She had fever to start with and chills with profound myalgia and went to another hospital where she was given analgesics for possible viral infections and she was sent home actually during her first encounter. Her COVID and flu at that time were negative. Her symptoms were persistent though and gotten worse, and she went back again. This time, got some more labs, and she was found to have neutropenia and thrombocytopenia. She was treated with oral antibiotics. However, she did not improve and had developed mild chest pain and dizziness with some new EKG changes for which she was transferred to us. She is kind of interesting because she presented to us at the end of March, and tick-borne infections are at the peak usually from June to July of the year. And she was also hiking in a county where ehrlichiosis was not reported so far in the CDC. So we treated her as a septic shock of a secondary bacterial etiology and had her on IV broad spectrum antibiotics. We sent out a bunch of labs, including blood cultures, which and variety of PCRs like HIV, EBV virus, Coxsackie, and Parvo. And being on IV antibiotics, she never showed any progress in her treatment. Her fevers were persistent, and her bicytopenia actually worsened with the development of new shock. Her labs started coming back. It was largely negative for the common infective panel, like I mentioned above. And with a history of tick bite a few weeks ago, we decided to start her on an oral empiric doxycycline, which promptly improved her clinically and lab-wise. Her fever started decreasing. She was feeling much better, and the shock was resolved. And her neutropenia and thrombocytopenia actually started improving. She had complete to near resolution of symptoms in 3 to 4 days of oral doxycycline. We were able to discharge her on an extended course of oral doxy. And with the history of tick bite, we actually did send a tick bite panel, which came back positive for Ehrlichia schaeffiensis PCR, suggesting human monocytic ehrlichiosis. So, a little more information on tick-borne diseases, and with the above clinical presentation and complete resolution of her symptoms with oral doxycycline, we came up with a conclusion that it could be due to tick-borne mediated ehrlichiosis. So the tick-borne diseases, they are usually transmitted through lone star tick, common in Indiana, and humans actually do serve as intermediate host in their life cycle. They are seasonal, as I mentioned above, and are usually confined to specific geographic locations as per the CDC reports. Our patient was a great exception to all those common parameters. And she's also a great reminder that we should get a thorough history as well to keep your differentials always open, which can save your patients in some of these rare possibilities. Hence, the valuable information we learned through her, I would emphasize, are tick bite cases do exist exceptionally outside of their normal habitat and seasons, and it can be a challenge to diagnose them. A high index of clinical suspicion is always necessary to identify them early to prevent serious outcomes, especially in older patients like ours, to prevent developing disseminated ehrlichiosis, which can prove fatal. So that's all about my case, and thank you all again for listening and giving me this chance to share this experience. Thank you.